culture, oftentimes patients travel to other countries to receive medical care from persons with whom they have the same culture or language. Then I think it's in human nature to find a place where they could easily relate, because let me say someone outside the country now, and then because okay, let me use Nigeria here. I went to the hospital one time in my school, and then because there was a doctor that was Yoruba, because I schooled in Ogun State, so there was a doctor that was Yoruba, and then there was another doctor that was Efik, that was basically from Cross River State. And then I could relate better with the person that was from Cross River because, oh, he shares the same culture or language with me. So imagine someone outside the country coming, maybe a Nigerian that is in the US or somewhere else or in the UK, coming back to Nigeria because they could relate better to their own. Then we have health tourism destinations. Aside professional healthcare, most patients travel to enjoy a refreshing atmosphere, which would aid speedy recovery. According to Malaysia Healthcare, the following are some of the most visited countries in medical tourism and their renowned services. We have in India Ayurvedic medicine and surgical services. That's like their traditional approach to medicine. So we have like their herbs, what they are well known for. Then we have Thailand. They are well known for their dentistry and affordable dermatological and cosmetic procedures. Then we have Turkey, transplant surgery. Examples like, I know that they are well known for their hair transplants. Then there's cancer radiation therapy, there's orthopedic surgery, neurosurgery, and genomic medicine. Then we have Malaysia. They are known for their hydrotherapy. Then we have South Korea. We have spinal surgery and beneficial insurance coverage. And then we have Costa Rica. They are well known for their eye surgery, cancer therapy, and bariatric surgery. Then we have Taiwan. They are known for their kidney transplants, cardiac treatment, and orthopedic surgery. And Mexico, well known for their dentistry and cosmetic surgery. So what are the benefits of health tourism? Saves costs. Health services provided in tourism destinations are relatively cheaper. I gave an example of the BBL procedure. That's like in the US, I gave the price range. That's 4,000 to 10,000. And then we have Mexico that is 2,500. That's basically 8,000 US dollars cheaper than in the US. Then we have reduces waiting time experienced in patients' country of residence. We have access to advanced treatment. That's basically the treatment that is unavailable in your country. You could get better, or what's available in another country. Then we have economic boost in tourism destination. We have international recognition of tourism destination. By foreign visitations and provision of services, a country may earn a positive or negative reputation for health tourism. So that's like basically through reviews. Like a lot of people give reviews about what they experienced in this country, and then you could either give a positive or negative feedback or reputation. Then we have creation of employment opportunities. Proper provision of health services by a tourism may lead to increased demand, the establishment of more facilities and more employment of the local citizens. So it creates better employment opportunities for the country of residents. So we have dangers of health tourism. The American Center for Disease Control and Prevention lists the following as risks or dangers of health tourism. The first one is infectious diseases resulting from medical procedure or treatments provided. So there's probably a higher chance of getting the risk of infections resulting from their medical procedure, their treatment. Then poor quality of care. The tourism destination may provide cheaper services, but may use counterfeit or unauthorized medicine in treatment because maybe the person is looking for something cheaper. Some people don't really go through the reviews. Some people don't really care so long as they've just heard a cheaper price. But whereas the hospital they are using counterfeit or unauthorized medicine. And then there's the possibility of unprofessional administration of healthcare or improper maintenance of facilities that exist also. An example of this is cosmetic surgery done in Tijuana, Mexico, which has recorded adverse effects on patients and has often been corrected in the United States. So this is basically, maybe this has been recorded in the United States, that like people coming from these countries from like after their cosmetic procedures have to be corrected later on in the US. So this is due to their poor quality of care. Then we have communication barriers between patients and provider in the tourism destination. So I'm in Nigeria and I'm going to Mexico, and then they're speaking Spanish and I don't understand anything. So like there's just that barrier that when anything could happen, and then maybe they won't be able to explain your rights properly or the procedures, and then you won't really understand what's going on, which is a potential danger to you. Then we have air travel complications. So traveling by air after medical procedure may aggravate the condition the patient initially traveled to receive treatment for. Like this could be due to various reasons. I think I've heard of like types of surgeries that you can't travel like by air because of like maybe the pressure or something. So you could have like complications and then you would not be able to fix it because you're traveling by air. And then there's continuity of care. Certain health conditions may require follow-up care after the patient's return. This type of care is often expensive and could be avoided if tourism was not embarked upon. So this is basically like follow-up. So after maybe the operation, you're meant to go for like, let me see, okay, after BBL, I think there's like, you have to get like different massages, and then that's for like the BBL procedure. So after BBL now, you have to get the different massages that to shape your body properly. And then some people, because they went to this country, they would come back to their own country and then they would miss the follow-up. And then follow-up care is most times expensive. And then this could have been avoided if they had not traveled out already. Then we have post-operative complications. Then we have hinders growth of residents' country's economy. Most times, a patient's country of residence may provide the desired services and tourism may not be necessary. Thus, the travel of the patient deprives such country to internal revenue, employment opportunities, and overall economic growth. According to Punch newspaper in an article published 13th December 2022, Nigeria had spent 6.23 million US dollars on foreign healthcare from January to August of that year. So you could imagine how much Nigeria had spent out of their own revenue on foreign healthcare. That's like January to August, not even January to December. But even if it was January to December, that's still like a lot. So it basically drains the economy of a country, of the resident country economy. Then we have our conclusion. In conclusion, health businesses are a great contribution of humans to the human race. They signify sacrificial dedication to the improvement of living standards for all mankind, one step at a time. Just as in general, entrepreneurship challenges in such businesses are inevitable. However, the presence of challenges cannot erase the important role that healthcare plays in our world. Health business owners are encouraged to start small, embrace risks, and enlarge capacity until all challenges are surmounted, for our world depends on them. Also, health tourism is not solely for the treatment of sicknesses, rather, it is a means by which a person is enabled to explore other parts of the world, encounter new cultures, share his ideas, and learn new ones. Although it has its adverse effects, one fact remains constant: all countries are not the same. Some are relatively better than others in the administration of healthcare. And then we have our references and our group members. Thank you very much.
Okay, can you hear me? Hello?
Yes, sir, we can hear you. Thank you very much.
Yes, sir.
Margaret, Ede, thank you very much for that presentation. I'm
Okay,
still watching you
Margaret,
now, Mr.
that was a good presentation. Your delivery was solid. Your confidence level was as if you have been doing it before now. So that was a good one. Okay, my inputs, you people left out a few things. Go to your challenges for healthcare delivery. Challenges of healthcare business. The challenges of healthcare delivery. Are you there? Okay, healthcare business challenges. Well, you mentioned cyber security. You see, healthcare businesses are not always online. A good number of them. This presentation made healthcare businesses look as if it's online from your challenges. It made it look, and the challenges are one-sided. You omitted things like standardization. I believe everybody here experienced COVID, right? Hello?
Yes, sir.
Hello? Okay. I believe everybody here experienced COVID. First thing you need to understand is that healthcare service delivery is classified as an essential service. So what that means is that nothing hinders anything that is related to healthcare. Nothing hampers the healthcare service sector. So you cannot say there is war. Even if there is war, you allow doctors to function. You allow nurses to function. In fact, in some war zones, you see Red Cross in the battlefield providing care, taking wounded victims out for treatment, and they are that much protected. That shows you the importance of healthcare service because it affects human life. And so when you talk about healthcare business, it is not only, I'm talking from your challenges, it is not only online. Those who sell pharmaceutical, yes, orders could be placed online, but there are also physical shops. So I'm talking about cybersecurity here as a challenge. You didn't talk about issue of standardization, one, issue of regulation, two, then issue of meeting with meeting with government agency requirements. What are the requirements to engage in the healthcare system, healthcare business? You didn't speak to those, and that's the area I am going to come in. For issue of standardization, it is a big challenge because, okay, I remember many years ago, a man told a story, an experience he had. He went to India to order for some drugs to be brought into Nigeria, some medication. And the pharmaceutical company in India asked him what compositions he wanted. That is the composition of the active ingredients. The man said he was surprised when they asked him how many percentage of the active. He said, what do you mean? He said, your people, when they come here, they tell us specification. Okay, this one, put 8, put 20 here, put 30 here, put 10 here, put 5 here. But at the end of the day, on the pack, it is going to read maybe 60%, 50%, 40%, as if they did the standard thing. So the man said he requested for the proper composition. But on a second thought, out of fear that they may not even comply, he aborted that business transaction and came back to Nigeria without placing that order. That's how he stopped that line of business. So a huge challenge in healthcare business is standardization. Even in medical equipment, the people who sell catheter, the people who sell URI bag, the people who sell the beds, hospital equipment generally, they are in healthcare business line. You will recall that during COVID, face mask or nose mask suddenly became a very important commodity and the price skyrocketed. A lot of people who never knew that something like face mask existed, a face mask that was like less than 1,000 naira pack rose up to 10,000 naira pack. Ones that they were selling like 1,550 naira, one became up to 500 naira because of the demand. Now, within that period, like I said earlier, the suppliers were allowed to do their business, but the issue of standardization comes in. NAFDAC under Dora Akunyili took steps to ensure that we get standardization in our healthcare supply chain, and the cabals in that business fought her. So a major challenge is standardization, ensuring that what is brought in is the standard. There are a lot of substandard equipment, substandard drugs, and that is where NAFDAC comes in for regulation. That is where Standard Organization of Nigeria comes in for regulation to ensure that whatever product that is coming into Nigeria or that is being manufactured within Nigeria meets the required standard. That is one. Then when you talk, where you talked about on health tourism, you didn't talk about the effects of health tourism to the society, particularly brain drain. Now, it is important for you people to know that the National Health Act has a section that talks about medical tourism. Even though I do not like the phrasing of that section, however, it is a fair attempt. What they are saying is that public officers are not allowed to go on medical treatment within or outside Nigeria at the expense of the government. Section 46 specifically of the National Health Act reads, without prejudice to the right of any Nigerian to seek medical checkup, investigation, or treatment anywhere within and outside Nigeria, no public officer of the government of the Federation or any part thereof shall be sponsored for medical checkups, investigation, or treatment abroad at public expense, except in exceptional cases on the recommendation and referral by the medical board, and which recommendation or referral shall be duly approved by the minister or the commissioner, as the case may be. Now, you already know, if your president is sick and is going abroad for treatment, he's the one that appointed the minister. So the minister will have no choice but to approve his treatment with public funds. The same goes to the governor or to the commissioner where a governor is sick. The commissioner for health will not hesitate to approve. But for me, I would have, even though one might say it is difficult to outlaw it, I would have had this provision state that no public officer should seek medical treatment outside the shores of Nigeria. Now, what that would have done, have you ever heard that a United States of American president went to China to seek medical treatment? What that would have done is it would have strengthened our healthcare service delivery such that the government of the day will be forced to build a world-class hospital that can attend to any ailment here, even if it is solely for the use of public officers like presidents and governors. We don't mind, but let it be here. Now, healthcare tourism, one of the major disadvantages is not just capital flights, brain drain of our professionals. Because when doctors hear that so and so place is paying better, they begin to gravitate towards that place. So they are not just moving there because of the living condition, but primarily because of the working condition. Then the salary structure. So healthcare tourism leads to capital flights. It leads to brain drain. Then what solutions can be done? Number one, you also omitted that offering solution to the problem. What could be the solution to healthcare tourism? One is building the capacity of our healthcare professionals. The government should strengthen the existing healthcare training institutions, medical training institutions, rejig their curriculum, invest heavily in paying the lecturers, invest heavily in getting modern day equipment for the students so that they can do practicals, invest even in getting foreign professionals to come and train our people here, or send some professors abroad to go and get trained and come back to retrain our people. Then invest what we do here most times. When we say we have built hospital, the hospital is not the building. The government builds a hospital building project, paint it very well, and it ends there, and we commission it with fanfare. But inside there are no equipment or modern day up-to-date modern equipment. There are no trained. Okay, let me not say no trained. Insufficient number of well-trained personnel to man that place. So the government needs to inject so much fund, not just allotting money, but carrying out the project. Because if it comes to budgeting, yes, the healthcare budget has not been enough for any year. There is no year that the healthcare has met, the budget for healthcare has met what is supposed to be. But utilization or proper management of the little resources that are allotted to healthcare. So it is a big challenge. Then the issue of organ harvests, particularly India, is a serious issue. So it's one of the risks that people face when they go on this tourism, that you went there with your 2 kidneys and without your knowledge. It is actually theft. It is so rampant in India that at any given opportunity, your organ could be harvested without your knowledge. It's a serious issue. Same with China. It's a serious issue. So it is a concern. Then, like you rightly mentioned, post-surgical care is an issue. That's why some people who go out to treat, to receive care, when they come back here, before I get to that, communication between the hospital here and the hospital outside. Sometimes the people who are going out to receive care, they make it look as if, okay, the hospital here, you are not doing anything. They even do it secretively. Do you understand? They just prepare their papers. Now, in doing it that way, they will not get proper results from the hospital here. Sometimes the hospital here might delay in releasing their medical reports to get there. Then when they go there and come back, because of the way they left the hospital here, continuation of their care here becomes an issue. So they go there, get treated. They are supposed, ordinarily, there is supposed to be a communication between the hospital here, which is going to continue the care, and the hospital there. But unfortunately, this healthy communication most times do not exist. So that breach in communication leads sometimes to a relapse and sometimes death of the person who has gone to spend millions outside to get health care. So healthcare tourism, I wouldn't say should not be encouraged. Yes, should not be encouraged, but it is life that is being saved. If we had it, or have we seen American citizens, Canadian citizens coming to receive healthcare in Nigeria? The answer is no. So the only solution is if we have a functional, efficient, and effective system here. That is the only way that it can stop. So stopping it is nowhere in sight. There might be mitigation or reduction, but outright stopping is not going to be possible. So that's just a few contributions I have to make. If there are questions, you can ask your questions. Hello?
Mr.
Hello?
Ebenezer. Yeah, can you hear me?
Yes, you can
Okay.
ask your question.
All right, sir. We have some questions that were sent in before the session, so I would send in the question to the chat box now and ask the question one after the other. Okay. The first question is, does health tourism have any effect on government spending? I know you touched about the app that talked about that.
Of course it does. Okay. All the while that former President Muhammad Buhari was outside receiving treatment, it's the government of Nigeria that was paying. And at the end of the day, they refused to tell us how much exactly was spent on that. So it has a lot on government spending.
The next question is, how can healthcare providers effectively communicate with international patients and address language barriers?
Okay. For language barrier, I know that China, India, they have such services. It's all part of the cost. You know, when we talk healthcare tourism, it is not just jumping into the plane and going to India. It is a whole, it has its own chain. There are Nigerian doctors who have relocated to India and are there serving as agents So you pay them. If there is need, their own business is to search out a hospital that is good in what you want to come and do. Prepare the doctors because they are there. They use their connection. It's a business. It's a racket. They use their connection, source for doctors, then the necessary papers you are supposed to do and all that. Your immigration, some of them dabble into handling it, even when they are not, even when it is not their line of business. Do you understand it? Now, for communications purposes, I know that China has language translators. Now, Chinese are primarily business people. They are business oriented in whatever they do. So that language barrier means you are going to pay somebody, or if that document is written in Chinese language, which is mostly what they do, even their normal contracts, they put it in Chinese language, then you pay somebody to transcribe it into English. So now you have go-between translators who will have to. But for effective communication, it is supposed to be between the hospitals. The Nigerian hospital here communicate because the case history is here. Do you get it? The thing started here. So the person has been attending hospitals here, but because the hospital here cannot handle it. So ordinarily there should be no barrier except language barrier. But sometimes due to conduct, the hospital here might be feeling let down. The patient might be feeling, I need to leave, so I don't care whatever, let's just go there. You know our people and attitude. Sometimes the hospital here might even pull out, leaving them. And because they already have Nigerians who are there, who are acting as agents, and some of these Nigerians are also medical doctors who are acting as they feel, okay, we have the money to help with you here. But ordinarily, there should be no, it's the life of the patient that is on the line. So both the hospital abroad and the one here should synergize to save the life of the patient. But everything lies in the hand of the patient. I have said it here before that attitude is everything. So to promote effective communication is for both the doctor here and the people abroad to know that they are working for the same purpose, which is to save the patient's life. And the patient should also understand that both the people here and the ones abroad are working for the same purpose. Once that understanding is achieved, communication will be easy.
All right, thank you very much, sir, for that answer.
Yes.
I'll be taking the next question. Are there any regulatory framework or accreditations systems in place to ensure quality standard in healthcare tourism?
Okay, is it for the people going out or for the people coming? For example, you know, there are hospitals here who also, there are hospitals here who also bring in doctors to come and carry out surgeries here. There are some top-notch hospitals in Nigeria that fly in healthcare professionals to come here, conduct surgeries or healthcare treatment, and go back. Now, for such, there are regulatory frameworks, one of which is that the person must be licensed to practice in that area of medicine. Do you understand it? 2, the person's immigration documentation has to be properly done. So for those coming in, there is a measure of control because you have to pass through our immigration, then pass through the medical and dental council before you can come in here to operate. Now, for those going out, for the patient going out, his or her documentation has to be properly done. Travel documents have to be properly done to ensure. Then the hospital the person is going to. Those ones we are outrightly not in, the government here is totally not in control of that. Someone is traveling, you cannot say you must go to hospital A or hospital B. Now, that is where those agents come in. But when you talk of healthcare business, there are, of course, documentations. Even if you are going for tourism, you need to show at the immigration, you need to show at the embassy that you are going for healthcare. So if you are saying you are going for healthcare, there is need for doctor's reports. There is need for a medical report from your hospital here. So if that check is not there, medical tourism could become a small screen for human trafficking. So there is standardization. You don't just walk into the airport and board any plane. Before you go, the embassy of the country you are going to, you need to submit. And it's not what is done with the, it's what you plan. For you to get ready and go out, it will take you, at least 1 month, 4 weeks of communicating, documenting, even if it is emergency. It will take some time before you get that. So there is documentation and standardization.
Okay, thank you very much, sir. While I'm asking the next question, I also encourage everyone that has a live question to raise your hand while I call on you to ask your question. So the next question is, how can healthcare providers develop successful marketing strategy to successfully attract medical tourists?
To Nigeria, I suppose. Hello? Hello? Can you hear me, Hassan?
Yes.
Okay. I suppose the question is to attract medical tourists in Nigeria.
Yes. Okay. Yeah, let's use that
medical tourists in Nigeria is beyond marketing. Firstly, is create a secured environment. When you solve the issue of security, you will attract not only health tourists, you will attract investors. 1. 2 is beyond marketing. When we improve our healthcare system, the news will naturally go fly abroad. Do you understand? If we improve our healthcare service delivery system, improve our healthcare facilities, train the personnel, there are private hospitals in this country that are already attracting health tourists, that foreigners come here to receive treatment. Yes, there are private hospitals that are already doing that. It will also interest you to know that in the 60s, Saudi Arabia, US, they were coming to Nigeria for treatment. It will research it. Do you understand it? That in the 60s, Saudi Arabia, this Dubai that people flock to now, they were coming to Nigeria to receive treatment in our hospitals. So it can still be achieved, but it is not, it is a multifaceted approach. When you solve the issue of security, such that a white man doesn't come to Nigeria for treatment and gets kidnapped or molested, when you solve the issue of security, you solve the issue of light, steady power supply, you solve the issue of road network, so infrastructure. Now, once these 3 issues are in place and solved, then you talk about building the capacity of the healthcare service providers. Then you talk about investing in the healthcare industry by strengthening the existing healthcare facilities and even building new ones. not painting them all. No, putting money, putting equipment inside those hospitals. Once that is done and people are beginning to see results, foreigners will be coming. Everybody wants to be alive. Foreigners will be coming here to receive treatments. And that becomes a foreign exchange earner for Nigeria. Now you know that when people come to an area, okay, when people come in for treatment, they will eat food, right? They will wash their clothes and do a lot of things with money that are not directly related to treatment. It becomes also economic empowerment for other dependent businesses. If you go to hospital, there are people who operate canteens there. So the patient has to eat that we buy from those people. So, but if you're saying, what can we do to just marketing? It is beyond marketing. It is far, far, far than marketing. So I need you to understand that.
Okay, sir. Thank you very much, sir. I believe that answers the question. The last question for today is, what role does technology plays in the growth of healthcare tourism and business?
Oh, technology plays very vital and important role. You talked about marketing the other time. Now, if we have a good, a standard hospital, there are a few private hospitals, like I said earlier. There are in Lagos, there are in Port Harcourt, there is in Abuja. Okay, for example, there's a kidney treatment center in Abuja. I don't want to mention their name so that it doesn't look like advertisements. But they are good, and people flock there for kidney transplants. Do you understand it? If people from far countries like China or maybe US or England, they may not come. But from our neighboring countries here, people can come there for treatments. Do you get it? So they are doing well. Now, if they now put their hospital, of course, they have a website, which is technology. If they put the hospital on the internet or do a story, there's one in Port Harcourt, the man does wonderful jobs and he takes time to document. In fact, that one, foreigners come. As you're coming, they document your arrival from the airport to everything till they finish your procedure. Every process is recorded. Then they edit it and do beautiful documentary and put it on the internet. Now, that automatically sells them. Okay, this is what we have done. This is what we have done. This is what we have done. That automatically sells them. And people get to know more about that particular hospital and they come to patronize them. So technology plays a very important role in both the business and tourism. When you talk about technology in healthcare business, all the social media platforms are technology driven. The internet, the website is technology. So information dissemination becomes easier. People can place their order online. You can put your store. You can even just do a video call. Okay, you want to buy some items. Yes, we have these items as just via WhatsApp. While the person is far away, wherever he is, you are here, you do a WhatsApp video call. I'm looking for this product. I'm looking for this is what you have. This is what you have. You pick it up from your shelf and show the person. The person say, no, this is not the one I'm looking for. This is the one. So technology plays a vital role and in promoting both healthcare tourism and healthcare business. How do our people get to know about those hospitals abroad? It's the internet. You search hospitals in India that can treat cancer, and the list comes up. Then the person makes his inquiries and puts his things in order. And as you're searching for the hospital, you're searching for hotels that are close to that hospital or within that city. And the person gets his answers immediately and makes decision on the spot on what to do. So technology plays a very vital role, both for the growth of hospital tourism and the business, healthcare tourism and business. Thank you. Can you hear me? Okay.
Thank you very much, sir. Thank you very much for answering all our questions, even though you are not feeling too sorry. And I wish you, we all wish you a quick recovery and to
Thank
get
you.
stronger very soon. So you can just, those of us on the call, you can put on your videos. Let's quickly take picture time before we go for today. Can see most of our mentees have left the call already. So for those of us that are
Why?
still on the
In
call,
fact,
I don't know,
why?
sir. I went to the group, I chatted everybody privately saying they should join the call. They all came. But I don't know why everybody's just leaving. Thank you very much, Edet. Thank you very much, Apple Cynthia, for
Okay,
staying with us today.
I think Gypsy should become more strict in managing.
Attending.
Okay, still the two people that started the class that are
Yes, sir.
still here. So I think Gypsy should become more strict and take your attendance from beginning to end seriously, such that as the mentees are not staying, they know they run the risk of not
Getting a
being
certificate.
assessed as having completed the training. So that
Yes,
is
sir.
it. Thank you very much.
Okay, thank you very much, sir. Let's just smile for the camera. All right. Okay. Thank you very much, everyone. That's the end of today's session. Have a lovely weekend. The weekend is almost over already, so just stay rest. Let's all rest. And prepare for Monday tomorrow, which is another work day.
Thank you.
Bye bye, everybody.
Thank you.
Bye bye, sir.
Goodbye. Thank you.